When you are living with cancer, life can become very different. People often struggle with understanding what is happening to them, as well as the physical, emotional, financial and practical challenges of cancer. Many people do not like talking about cancer and how it is affecting them, and they find the idea of talking upsetting or uncomfortable. But talking to someone about how you feel can help you cope with your emotions and can make you feel supported. It can also help you make decisions that are best for you. You can talk to someone you know well, or choose someone else such as your consultant, GP, cancer nurse specialist, or a counsellor or psychologist. Living with cancer can impact the life of the patient and the life of their family and friends. It is common to have many different emotions, and there is no right or wrong way to feel. These emotions can be difficult to cope with, and your partner, family and friends may also have some of the same feelings. Shock, denial, fear, sadness, anger and guilt are all common emotions that cancer patients might experience, and there are things that you can do to help. For example, speaking to a friend, your GP, or talking to someone at your local information and support service. Your clinical nurse specialist is always available for support, whether you are having active treatment or not, and beyond that you can ring the National Macmillan helpline on 0800 808 808. After treatment is complete, you can also experience a mix of reactions. Sometimes the emotions are positive, and you may have discovered new personal strength and deepened relationships with your loved ones during treatment. But it is also normal to have feelings that aren't positive. Some describe the period after cancer treatment as dropping off the edge of a cliff, and this can be confusing or scary. Please do reach out to someone if you feel like this. You don't have to face this alone, and there are supportive community services that can help you. Most people are not surprised by strong emotions during treatment. However, they can be surprised when new or old emotions occur after treatment is completed. After treatment is complete, you may find that you have more time to yourself to think, and this causes a period of reflecting about your experiences. You may find yourself feeling alone with your thoughts as loved ones have returned to work and you have less appointments with healthcare professionals. Please do reach out to someone. This could be your GP, your cancer nurse specialist, or your local information and support service. You are not alone. Managing family life and work, as well as living with cancer, may also seem challenging. Having cancer might mean that you are unable to work, and you worry about how you are going to pay your bills, while for some people increasing debt, fuel poverty and poor housing is an issue. Getting advice on benefits and welfare rights is something that the team at the hospital can help with, and you can usually access a cancer welfare rights advice service for support, or alternatively through the National Macmillan Cancer Support Helpline. At your local cancer information and support service, they can spend time listening to you on the phone or face to face to explore what support or advice you might need. They may use a holistic needs assessment, which is a questionnaire that you may have encountered before, to identify your main concerns. Cancer treatment and stress can also cause physical symptoms such as pain, extreme tiredness, sleep problems and loss of appetite. How long these last and how severe they are is different for everybody. There are things that you can do to help yourself feel better, such as getting enough sleep, eating well, exercising, stopping smoking, doing things you enjoy like reading, listening to music or going for walks. Sometimes speaking to others in a similar position can help, and information about local support groups within your community can be found through contacting your local information and support service. Remember that the local cancer support services are there for you. Talk to your healthcare professionals or go direct to the local services and get the help and support that you need.